Hi, I'm Amy McCarter. Welcome to House Calls brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glenn of Topeka about chronic sinusitis. Thanks for being here today.
Thank you for having me.
What exactly is chronic sinusitis?
Chronic sinusitis is a persistent inflammatory change involving the nose and paranasal sinuses. Typically, for it to be a chronic process, we would expect this to be lasting greater than 8 weeks despite medical therapy.
What are some of the symptoms?
Typical symptoms, as you would imagine, would be nasal congestion, facial pain and pressure, anterior and posterior nasal drainage, sometimes some relative decrease in their sense of smell or their ability to taste. So typical symptoms of a head cold.
Okay, and how is it diagnosed?
Diagnosis is both through a physical evaluation, where we're looking for problems such as a deviated nasal septum, drainage from the sinuses, inflammation of the nasal cavity. We sometimes use an endoscope, which is a small camera scope, which allows us to see this in more detail. And typically, we would also use a CT scan, which can be performed on the same day of the visit, which gives us a roadmap for the sinuses and gives us a perfect picture of the degree of inflammation.
How is it treated?
Treatment is typically medical initially. We use a combination of saline sprays, antihistamines, topical nasal steroid sprays, and antibiotics. If these have failed and symptoms persist, that's when surgery can come into play. This would improve, hopefully, your ability to breathe through your nose and the ability for the paranasal sinuses to drain.
And at what point do you know you should call your doctor?
Anyone exhibiting symptoms of recurrent sinusitis, so multiple sinus infections lasting shorter than several weeks, or persistent sinus symptoms greater than 8 weeks despite medical therapy.
Okay, good information. Thank you for being here today.
Thank you for having me.
Please join us next week for a new health topic discussion on House Calls.